Hello and welcome to Health Live at Seniors Today. We are delighted to have here with us Dr. Pankaj Ahire. Dr. Ahire is a leading orthopedic surgeon and is attached to the PD Hinduja Khar, Nanavati Max, Godrej Memorial, Holy Spirit and the Saifee hospitals in Mumbai. He is the Honorary Secretary of the Indian Society for the Surgery of the Hand, a member of the Bombay Orthopaedic Society, the American Society for the Surgery of the Hand, and the International Wrist Investigators Workshop. His special interests include wrist trauma, wrist arthroscopy, and sports injuries of the upper limb. Before we started the session, I was having a chat with him on the sidelines, and I was told that at this point of time, there are around 200 specialists in hand and wrist surgery in India, perhaps lesser in the field of wrist surgery, and there are just 5 of them in Mumbai. So we are, Dr. Ahire is one of the handful of the hand and wrist specialists. And this is an area that we have not dealt with in the past. So we are really delighted to have you here with us, Dr. Pankaj, for this session with our readers of Seniors Today. And we have received a few questions already, and I'm sure there will be many more to come. So welcome once again, and over to you. Dr. Ahire will make a short presentation, and then we'll be open to questions. So if you have questions, as usual, please put it on the Q&A tab, and we will then address it to the doc. Thank you and welcome.
Thank you, Mr. Maheshwari, for the kind introduction. I was delighted when you invited me to talk on this particular topic. Because hand and wrist problems are something which a lot of people take as part of aging, something which needs to be lived with. Many of them not even aware that these require intervention and can be improved upon. So the purpose of my today's presentation is not to make a very didactic lecture, but just to introduce a few terminologies to our audience so that we have a very fruitful question answer session. So I'll just many years ago, I visited this museum in small town in Maharashtra, and I was completely impressed by this sculpture of a blind woman who is trying to feel and guess the world with the tips of her fingers. That's exactly how important our hands are. They are not just a mechanical tool to grasp objects, to write, chisel, and perform tasks of daily living, but they are a very important sensory organ which connects our body to the exterior, just like your eyes, ear, and nose. And therefore, restoring the hand to its normal stature is utmost important to maintain a good quality of life. And especially as we age, we realize that we do tasks in our hands, by our hands, which we were not used to before. For example, just simple act of getting up from chair cannot be accomplished without the support of the hands. Even if most elderlies require hand support in the toilets, in the bathrooms. They find it difficult to climb on the stairs without the railings. So upper limb actually becomes very important for ambulation, and so much so that a lot of joint replacement surgeries need to be put on hold because the hands of the person who wishes to undergo a knee replacements are not in a condition to grab an orthotic or a walking aid because of some other problem. Just like there is arthritis in the knee joint, there could be arthritic changes in the hand and wrist, which that does not allow the person to use a walking stick or a walker, and therefore, until the hand and wrist problem is treated, the surgery for the leg needs to be put on hold. It's an important organ of proprioception, that just like the sculpture which I showed you, with diminished vision, with lights off in the middle of the night, trying to feel for your glasses, your water bottle, a switch. How do we reach out to these objects without having to actually look at them in full light? That ability is called the proprioception. So we instantly know what lies within our space. Therefore, it is said that your own space, individual space, is defined by where your tip of the hand can reach. That's how important it is, important to preserve the sensation and the function even in the tips of the fingers. And therefore, I'm going to speak to you about a few problems which are specific to the elderly population. And more so, I will restrict my discussion to hand and wrist. So when we talk about hand and wrist problems, we could talk about a bony problem or a soft tissue problem. Soft tissue being skin, tendons, nerves, blood vessels. And we could talk about problems which are because of aging, degeneration, or problems which happen because of injury, trauma. So when the bone, the degenerative problem associated with the bone could be arthritis, just like you have knee arthritis, there is arthritis in the hand. Then in soft tissues, you have tendon degeneration, nerve degeneration, and ligament degeneration, leading to various problems, some of which we will see today. Trauma to the bone leads to fractures, and of course, trauma to soft tissues leads to cuts and bruises. So what we are going to focus on today is arthritis, fracture, tendon, nerve, ligament, soft tissue injuries, soft tissue degeneration. So when it comes to degeneration and arthritis in the joint, the tips, the joint which is near the tip of the finger is called the distal interphalangeal joint, or DIP for the short. It develops this deformity. Now, this deformity is a result of bone growth that happens because of degeneration of the joint. This is exactly like the arthritis of the knee joint. And this condition is called the Heberden's nodes. And when a similar swelling happens in the joint closer to the wrist, this one, okay, which is called the proximal interphalangeal joint or the PIP joint, it's called the Bouchard's nodes. You can have joint erosions because of rheumatoid disease, and it presents very, in a very different fashion. It causes more problem in the knuckle area. These are the knuckles which are completely arthritic. It leads to extensive joint erosion, and it's a soft tissue problem as well, causing imbalance and various deformities. Just like you can see that the fingers are drifted towards, all the fingers are drifted outwards towards the little finger, and it's called the ulnar drift. This is a very different problem because it's a systemic problem. It's a problem which is affecting entire body and all the tissues, and not specific to the hand. The commonest degenerative disease in the hand is the arthritis of the base of the thumb. As the arrow points out, it's very close to the wrist. This is the wrist joint, but it is not actually the wrist. It's the base of the thumb. It's the commonest arthritis in the upper limb, just like knee arthritis is the commonest arthritis in the lower limb. And this can be extremely painful. There are various treatments available depending on the stage of the disease, right from simple resting, splinting, steroid injection, and many times surgery. If not treated in time, this can lead to very grotesque deformity of the thumb, and therefore it needs to be identified, graded, and treated, and then followed up diligently for long periods of time. This is how the degenerated joint looks, and because this bone of the thumb, the metacarpal of the thumb, because it shifts out, you see a bump in that area where people who have this CMC arthritis. The wrist arthritis per se is not very common, and it very commonly presents either as a part of rheumatoid disease or as a result of old fractures or old ligament injuries of the wrist, or ligament disruptions which happen because of degeneration, which is age related, that leads to secondary arthritis of the wrist. There are a lot of treatment options available of the wrist. Some of them need to sacrifice the movement of the wrist, some of them preserve the movement of the wrist. The commonest fracture in the wrist, in the upper limb, in the elderly is what is called the cholesis fracture. Fracture of, which happens just around 2 centimeters away from the wrist joint. This fracture was described more than 200 years ago. This is the commonest fracture and happens because of weak bones. Good part is for most elderly population, say somebody who is more than 65 years of age, this can be treated without any complex intervention, because despite a very bad looking deformity in the wrist, most elderly people will gain very good function despite not doing much to this fracture. Whereas for a population below the age of 65 years, this may need a surgery, a plate fixation in order to correct the deformity. When it comes to degeneration of the soft tissues, the commonest are the tendon related ones, trigger fingers, because they can happen in any digit, trigger digit. Something which happens close to the wrist is called the decurvence tenovaginitis, and sometimes there are degenerative tendon ruptures that happen in the elderly. A commonest nerve-related problem in this age group is the carpal tunnel syndrome. We'll just touch upon this. Trigger finger is basically a finger which gets stuck in the palm and snaps out when you attempt to open it like a trigger of a bullet. It happens because the tendon gets stuck somewhere near the knuckle on the inside, and only when you exert a lot of power, the tendon travels across a pulley and snaps open. The simplest form of treatment for trigger finger is surgery, though many of the trigger fingers may not need surgery and may resolve in about 16 to 18 months spontaneously. Decurvence tenovaginitis happens along the thumb tendons. It is again a similar kind of a problem as a trigger finger. However, here triggering is not common because the tendons are very slender. However, this is acutely painful, especially anything that requires you to grasp the object very tight with your thumb, or twist, like opening of a tap, opening of a door, opening a cupboard handle. All these activities will cause severe pain here. Occasionally, this can be treated with a steroid injection in this area, but most often than not, either it will resolve spontaneously or it will require surgery. The common deformities in the finger we have are called the swan neck deformity, or boutonniere deformity, or a windswept deformity, or a drift. So this is like a swan neck deformity, a neck of a swan. This is a boutonniere deformity, and this is a windswept deformity or ulnar drift. Now, why do all these things happen? These happen because of the degeneration of the ligaments and degeneration of the tendons which are controlling the muscle, controlling the movement of the fingers. The moment there is an imbalance in the forces which are acting on the fingers, these deformities are produced, of which typically the boutonniere deformity does not require any surgical intervention, but the swan neck deformity or the windswept hand like this will require surgical intervention. As a soft tissue degeneration, sometimes the tendons can snap spontaneously because they rub on an arthritic bone. In this case, you can see the right hand, the thumb cannot be put in a position of a thumbs up sign. That happens because there is a tendon which has ruptured in the wrist. That's called the Epl rupture. This is also called a drummer boy's palsy. So this is not only degeneration, this also happens because of a repetitive stress on the thumb tendon. This definitely and positively requires a surgical intervention. Then the next is, as you can see, this person is attempting to straighten all 4 digits, but the little finger and the ring finger cannot be straightened. So just like the thumb tendon had ruptured, here the finger extensor tendon, or the tendons which straighten the fingers, has ruptured, and that rupture usually happens at the wrist level because there is some problem in the wrist. There is arthritis in the wrist and the tendon is rubbing on the sharp bone edge and it ruptures. This also requires surgery for restoration. The commonest nerve problem in the hand is what is called as a carpal tunnel syndrome. So what exactly is a carpal tunnel syndrome? The bones in this area, there are 8 bones, and those are called carpus. Those bones are arranged in such a way that they form a tunnel, and the tunnel has a roof, as the ligament has a roof. Under that roof passes a nerve, a very thick nerve, which supplies the 3.5 digits of the hand. Now, the moment there is compression of the nerve, variety of reasons, the person starts getting tingling, needles and prick sensation in this area, which is marked blue, and sometimes it becomes hypoesthesia, that is less sensation, and sometimes there may be no sensation at all. Also at the same time, person starts getting wasting of the muscle here. You can see the hollow over here. That happens because the muscle which pulls out the thumb away from the palm has now lost its function, and then you get this hollow over here. This condition definitely requires surgery, but however, there are a lot of non-surgical options in the early carpal tunnel. There are other problems in the upper limb as well, which cause pain in the upper limb. One is the frozen shoulder, and other is osteoporosis. Perhaps this could be out of today's purview, but I'm happy to answer any questions related to this, should there be any. So we need to understand that the problems, the hand and wrist pain problems in the elderly, they can have a definitive cause. It cannot be just ignored as age-related, hone hi wala hai. No, they have a definitive cause. These are treatable conditions, and the treatment of these conditions is required to maintain an optimum quality of life. And I would put in bracket, though I'm not put it here, that optimum quality of life means living with dignity, not being dependent on each other, not being condemned to tolerate pain, not consuming painkillers on a regular basis. That optimum quality needs to be maintained. If we have to, live a fruitful and a useful life and continue to be useful in the society. I'm happy to take any questions that are related to any problem in the upper extremity. Even if they have not featured in this discussion, I'm happy to take it.
Thank you, Doc. There are a few questions that have come in.
Sure.
And I'm going to, with your permission, shall we start?
Sure.
So this is a question from someone who's not put her or his name. I am 56 years old and I have felt that my hands and wrists are losing strength rapidly during the past year or so. Things I pick up slip out of my fingers. I also suffer from pain in my fingers and hands. What is your advice?
The commonest reason for this type of symptoms, in absence of any other disease that the person may be suffering from, like diabetes or rheumatoid disease, if those conditions are not present, then the most common cause of these symptoms is the carpal tunnel syndrome. One of the earliest things that people will notice is, apart from the tingling and the pain in the hand, is things slip away. They find it difficult to grasp a cup of tea with one hand. They would always support it with the other hand. One of the distinguishing features for this is if these symptoms get aggravated in the middle of the night, that the person wakes up with discomfort and tingling and numbness in the middle of the night, that is almost suggestive of a carpal tunnel syndrome. Apart from mechanical compression of the nerve, severe vitamin D deficiency, severe vitamin B12 deficiency can aggravate these problems. So it helps to take these two supplements on a regular basis. As a part of initial treatment in the early stages, say if it is not causing any numbness in the fingers or has not caused any hollow in the thumb, till that time, then you can do what is called as a nerve mobility exercises or neurodynamic exercises. So if you just Google what is neurodynamic exercises, or speak to a physiotherapist and say, I want to learn neurodynamic exercises for the nerves in my hand, they will teach you. These exercises help mobilize the nerve. However, if the problem persists, then there is a certain investigation called EMG-NC, electromyography nerve conduction study, which is available in most hospitals in Mumbai. It's a simple test, will cost you about 45 minutes of your time, and that can establish a diagnosis where the nerve is compressed and how severe is the nerve compression.
Doctor, now, carpal tunnel syndrome does impact a host of people.
Yes.
Even the fact that, you are on the computer, you are on the mobile phone and all of that. Yes. What is it that people can do to ensure it doesn't happen to them? Because, like this person said that it has happened to it has happened only a year back.
Yes.
So is there something that you can do to prevent it?
Yes, in fact, there are a lot of ergonomics which come into play when you talk about prevention of carpal tunnel. Anything that causes continuous pressure on the wrist is to be avoided. So people who work on computer with a mouse, they should keep some padding between the table and the wrist. They should try and use the mouse without the wrist touching the table too often. Many times we suggest using a mouse which is like a joystick. So instead of the mouse being held like this, is the joystick which is held like this. So there is no pressure on the nerve here. This is a direct relief of pressure on the nerve. There are other factors which need to be looked after. One, diabetes needs to be well controlled. Your vitamin B12 supplements levels need to be checked from time to time, at least once in a year. If a person is suffering from hypothyroidism and is on thyroid supplements, if your thyroid hormone levels are not normal, that can lead to swelling of the tissues and compression of the nerve. Being overweight can add to the volume of the contents of the carpal tunnel and cause compression. So these are the avoidable and reversible factors for carpal tunnel.
Thank you. We have another question which has come in, which is, I am 62 and recently fell and hurt the outer part of my right hand.
Yes.
No fracture, but the X-ray shows tendon damage. I have done quite a few physio sessions and it's been 4 months, but the pain and lingering weakness persists.
Okay. So what I understand is the injuries on this side of the wrist, perhaps, is from the description. Okay, if it is a tendon injury, X-ray is something which will not be able to diagnose it. If there is a persistent pain and the X-ray is completely normal, then the next best investigation to diagnose such a condition is an MRI. Now, MRI for the wrist or the hand should be done preferably in a 3 Tesla MRI machine with a dedicated wrist and finger coil. So there are very few places in Mumbai which will have these. Doing a wrist MRI in a knee coil or a spine coil may not give you adequate information. So if the pain has persisted for 4 months, I believe it requires a further diagnosis. Physiotherapy without knowing the cause of the pain may not be the right step. Sometimes inadvertent exercises can cause further damage to the soft tissues which need to be given time to heal. Most soft tissues injuries, which are of minor nature, generally heal in about 3 weeks' time. Significant ligament injuries, tendon injuries, not the cut ones, but maybe contusion in the tendons, can take around 3 months to heal. So giving enough time for injuries to heal is very important, and you should not hurry through going to the physiotherapist.
Thank you. We have quite a few questions which have come in. So so there's one question which says, since a few weeks, I find that I have a bit of a tingling sensation on my palms and fingers. What should I do? Okay.
So typically, again, the commonest reason for tingling sensation in the palm is carpal tunnel syndrome. However, remember, when the nerve leaves the cervical cord, the spinal cord in the neck, till it reaches the finger, it can get compressed at many places and cause symptoms in the hand. The commonest, as I said, is carpal tunnel. Sometimes you get compression of a nerve in this area, in which case the little finger will become numb. And if there is compression in the neck, just like you have a slip disc in the back, lower back, you have slip disc in the neck, you can get numbness not only in the hand, but also in the upper part, the forearm or the arm or the shoulder. One thing is sure, if it is tingling, it has to do with the nerve. Either there is a direct mechanical compression of the nerve, or there is something wrong with the quality of the nerve. The quality of the nerve is affected by vitamin B12, diabetes, whereas compression of the nerve is either carpal tunnel, near the elbow cubital tunnel, what is called as a thoracic outlet, and the neck. So How do we distinguish whether it is compressed here, 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 or here? Is EMG-NC. Of course, a good clinical examination by your doctor will also be useful in deciding whether you need to go for any advanced investigation or not. But this is very likely either a mechanical compression or a non-mechanical reason like vitamin B12 or diabetes.
Right. And the right doctor is somebody who is a hand and wrist specialist like yourself.
You do not need to go to the specialist right away. Most often, your family doctor will be able to guide you. If not, yes, then you should seek a treatment on his advice, his or her advice. You could seek advice from a hand and wrist surgeon.
Thank you. We have a question from Darshana Ogare, who says, I'm 63 years old. I recently recovered from herpes. Ever since, I've had pain in the joints, in particular my wrist and thumb. I was unable to pick up a cup of tea. Is this a temporary after effect or should I be taking treatment?
Okay, if your herpes was in the same area from where the nerves to the hand emerge, say in the neck area, then this is typically a post-herpetic neuralgia. It can last anywhere between 3 months to 6 months, and there are very specific medications to take care of post-herpetic neuralgia. However, not being able to grasp objects or pick up objects because of pain in the thumb is unlikely to be related to herpes, because herpes can cause a deep-seated pain in the distribution of the nerve, but it may not cause pain on movement of the joint or the tendon. The very common reason for pain in the thumb area while grasping the objects or inability to grasp objects because of pain is what is called the decurvance tenosynovitis. That is where the pain is in this area. This is your wrist joint. The pain is slightly away from the wrist joint in line with the thumb. You might feel a small bump there, and when you press there, it is very, very painful. And one of the tests is you can put your thumb in the palm and hold it like this and just twist. If this produces a very severe pain in this area, you know you are dealing with a tendon problem called decurvance tenovaginitis. Very often, simple period of rest and splinting of the thumb to avoid movement of the thumb for a couple of weeks will solve the problem. If not, the next stage would be to give an injection in the area in the tendon sheath. And if that also does not work, quite often a small surgery may be required to release the thumb tendons over here. It is quite unlikely to be related to herpetic neuralgia.
Right. Thank you, doctor. We have a question from an anonymous attendee who says, my fingers, 2 in the right hand and 1 in the left, are bending. I have taken medicines, but there is no improvement. What is the remedy? And this person has also added that bending of fingers is inward. If I try to straighten them, there is pain.
Okay. Now, inward bending of the fingers like this can happen because one of the 2 reasons very commonly. One, which is a completely reversible one, is trigger finger. If the finger just remains stuck like this and does not open, and then per force you may have to open it and it causes severe pain in this area. That is trigger finger, which the treatment of which very simple, rest, medication, and if it's too troublesome, then a small surgical release in this area. There is ideally no role for steroid injections in this area because the risk-benefit ratio is very, very skewed. So simple surgical release will help. The second cause for inward bending of the fingers is what is called as a Deputarians Contracture, in which there is contracture of the skin is bunched up here and it doesn't allow the finger to straighten. But the distinguishing feature is the Deputarians Contracture is never painful. It is very slowly progressive. So if you are having a slowly progressive bending of the fingers with bunching of the skin in this area and which is not very painful, it is Deputarians Contracture. Now there are very strict criteria which have been laid down for surgery of Deputarians Contracture. If your joint is bent more than 30 degrees and it cannot be straightened because of skin contracture, it might require surgery. So we need to distinguish between the two. Again, a simple clinical examination, only looking at the finger, we will be able to distinguish whether it is Deputarians Contracture or whether it is a trigger finger.
Thank you. We have a question from Neeta Nayak who asks, I have carpal tunnel syndrome. Would omega-3 tablets help? And does homeopathy have any cure?
So as I said, carpal tunnel can have a mechanical cause or a non-mechanical cause. I have not come across any literature paper which links carpal tunnel to deficiency of omega-3 fatty acids or consumption of them causing relief. There would be anecdotal stories people will have. I have no knowledge about homeopathy helping it. However, as I said, since there is a definitive cause to this ailment, it makes logical sense to treat the cause rather than experiment otherwise.
Right. We have a question from Nisar Ukabhoy, who says, I'm 78. I have recently noticed a slight projection in the joint near the tip of my left hand right finger. I also get very hot sensation at a particular place in the right index finger and occasionally in either of the toes. Lastly, in winter, my fingers get stiff during the night. When I get up and go about my work, they gradually become normal.
This is very classical presentation of osteoarthritis in the hand. The first picture which I showed you called as Heberden's nodes, the swelling in this area and a painful joint. Now, your observation that the fingers ease out as the day progresses says that the problem is very much reversible. So warm water fermentation when you get up in the morning will help ease out the fingers. Medical treatment on exactly similar lines as osteoarthritis of the knee joint. There are supplements like glucosamine, chondroitin sulfate. These will help. There is a very small number of people who actually might require some kind of an intervention for this problem. If the fingertip is severely deformed and is coming in the way of your day-to-day function, it may have to be put in a correct position by surgery. If there is a huge bony outgrowth here, which is causing a lot of pain, that bony outgrowth may have to be shaven off. And sometimes, because of arthritis, there are mucinous cysts. They are called pseudomucinous cysts, but the mucin is a jelly-like material, and there are cysts which form here, much like the ganglion which forms at the wrist. Similar swellings happen here, and those might require to be either aspirated using a needle or may have to be surgically removed in order to make the joint move better. Will this joint, a tip joint, ever move the way it was moving when it did not have arthritis? No, it will not. Important thing is it should not have a deformity and it should not be painful so much that you need to take a painkiller every day. Till that time, you can continue with the non-operative treatment.
Right. Thank you. We have a question from Mr. Radhakrishnan, who says, in the night, my wife's, who's 58 years old, her forehand and legs become cold after a couple of hours of sleeping. This is happening for a few years, but there's no pain.
So this is an obscure symptom because this is not pointing towards anything. However, I would still try to answer this. There are a lot of patients who present with muscle spasms or tightness in the muscles in the calf mainly, and sometimes in the forearm. This could happen because of vitamin E deficiency, vitamin B12 deficiency, awkward posture while sleeping. Some patients get compression of the blood vessels in the neck area, and in a particular posture while sleeping, there could be crowding of structures here and causing the blood supply to the hand going down. Just like you have a carpal tunnel syndrome here, there are a few nerves which get compressed in this area of the forearm. Those are rare occurrences, but they do get compressed. A good clinical examination should be able to tell us whether this is a nerve-related problem. Until that time, I would simply treat this with simple vitamin E and B12 supplements.
Thank you. There is a question that, is there a need for a preventive checkup to be done for people above the age of 50 or 60 to ensure that they don't have any problems like these occurring in their later years?
Okay, I would not recommend so, because most of these problems that we are discussing or we have seen, some of them may not have been presented in my lecture as well. Most of them, they will declare themselves. You just need to be observant about subtle changes that are happening and not pass off anything as simple age-related problem. Not everything requires extravagant investigation or treatment, but it would help that if you notice something abnormal, just get yourself checked. I don't think there is any role of preventive checks as such.
That's important. We have a question from Mr. Raghavendra Odia, who says, on getting up in the morning when I stretch my legs, occasionally, not every day, I feel an agonizing pain in the calf area, which persists for a minute and subsides. Could you suggest a solution? I know it's a calf area and it's not really your...
Yeah, so muscle tightness, especially in the calf or back of the thigh or lower back muscles after an overnight sleep, is not uncommon. This could be related to something as simple as consumption of less amount of water, having less amount of sodium in your circulation. So ensure that you are drinking enough amount of electrolyte solutions during the day. Many people drink a lot of water, thereby diluting the amount of salt in their body. It's important to have liquids which have enough electrolytes in them. Drinking enough amount of water is important. Again, as I said, most of us may not have very balanced diets. So a regular supplement of vitamins after consulting with your family doctor is important. And many times these aches and pains that the similar to what the gentleman described would be taken care of by simple vitamin supplements.
Thank you. We have a question from Aruna Chenani, who says, I can't close a fist tight with my thumb inside. She is 77.
Yes. So if this is what she means, that if this is what she is not able to do, now why she is not able to do that is important. She may not be able to do this because of 2-3 reasons. One, there could be arthritis of the thumb over here, thumb base, or there could be something called as a decurvance tenosynovitis, which does not allow her to bend the thumb and it causes pain. So if the cause for not being able to do this is pain, then it needs to be investigated. These are the 2 common factors which need to be investigated. Now, as far as the tendon problem, the decurvance tenosynovitis problem is concerned, it doesn't require any investigation. It just requires a clinical examination, whereas a CMC arthritis here requires an X-ray to diagnose. In either of the cases, this is a fully treatable condition. The first step, even before you go to the doctor, if you don't want to step out too often during the lockdown, the first step is reduce the movement of the thumb. Where any commercially available thumb splint, there are a lot of thumb splints available commercially. Wear these splints for about 3 weeks throughout the day. Apply ice packs, take very simple anti-inflammatory medications, and chances are that the problem will subside. If it does not subside, then I am afraid you have no choice but to get this examined to find out whether it is a bone-related problem or a soft tissue-related problem.
Thank you. We have a question, and there are quite a few questions that have come in, Doctor. So I will think we'll need 10 minutes more of your time.
No, absolutely no problem.
So we have a question from Mr. Brijendra Kumar, who says, I'm 76 years old and started to play tennis after a gap of about 30 years. And my forearm got swollen and I have had severe pain with the result that I could not lift the racket only after just 2 days of play. What should I do to take up the game without forearm and wrist pains?
Okay, so if the pain is in somewhere in this area after you attempted to do something which you are not accustomed to, it could be a tear of the muscle near the elbow here, near the tear over here, what we call as a tennis elbow, or it could just be one of these tendinitis that I told you where the tendons are rubbing. Either ways, you must use a very lightweight racket. Ensure that you buy a good quality lightweight racket. Until you get accustomed to this sport, avoid a single hand smash. Try and use both hands together so that the load is taken off from one hand. In any case, before you undertake any activity which you are not accustomed to, you must condition your muscles before you jump into the court. So I would say something called, just note down the title. It is called eccentric loading exercises of the wrist. Eccentric loading exercises of the wrist. If you just Google this or speak to your physiotherapist, where you are basically increasing the endurance of your forearm muscles which control your wrist movement, and then you will be able to do the hobby sport without any problem. There are a few types of braces that are required. One of them is called as a counter force brace. Counter force brace for tennis elbow. So these are the two things I would recommend you, with the risk that I have not examined you.
Right. Thank you. There are 3 more questions. One is from Mr. Arvind Navare, who says, my right hand ring finger is paining while opening the hand. That particular finger opens slowly, that too with a jerk. I have taken leech therapy recently. Pain has reduced, but pain has not stopped, although it's bearable. Before that, my doctor gave me steroid injection in that particular finger. And with that, there was no problem for, say, 3 years. What would you advise now?
So from the description of the problem, it looks like it is a trigger finger that you are dealing with. I do not see any use of leech therapy for this. As I said, steroid injection for a trigger finger can be used. However, the risk-benefit ratio is completely skewed. The only intervention that should be done for a trigger finger is surgery. Until the time of surgery, you need not do anything. This is not a problem which culminates into something big. A trigger finger today will remain trigger finger after 5 years, except for the fact that either the severity will reduce or severity will increase. It does not complicate into something bigger. So don't try to search for remedies for trigger finger when a very simple 5-minute surgery under local anesthesia, which gives permanent predictable relief without any complications, is available. There is no need to search for another form of treatment which will be unpredictable. The side effects of steroid injections are quite troublesome. Therefore, I have never used steroid injection for trigger finger in my practice. I'm in practice of hand surgery for more than 20 years now. Now, I have not given a single injection for trigger finger till now. So that's how much I see a risk in injection for trigger finger.
Right. Thank you. We have a few more questions. One is Mr. Devendra Gara says, I'm diabetic. I get pain in the tip of my fingers often.
Yeah. So for a person who has been diabetic for a very long time, the fingertips can become painful, problematic because of a couple of reasons. One, diabetic patients are more prone to develop carpal tunnel syndrome because the quality of the nerve and the microcirculation around the nerve, the quality of the nerve fiber, their ability to regenerate is affected. Many times, diabetes causes microvascular compromise. So the circulation to the tips of the fingers may get affected, and that can cause pain. It can be a sign of what is called as a peripheral vascular disease, PVD. Or a person with long-standing diabetes can have problem related to all the peripheral nerves in the body, where the quality of the nerve and the degeneration gets affected, and there is a pins and needle sensation, or there's numbness at the tips of the fingers. This is called as polyneuropathy, diabetic polyneuropathy, or a peripheral neuropathy. Peripheral neuropathy is not completely reversible, but can be treated with a lot of medication to give you good relief. If it is a peripheral vascular disease, it requires good amount of investigation, including a Doppler, and it needs to be seen by a vascular surgeon. Vascular surgeons are subsets of cardiovascular surgery. There are vascular surgeons who exclusively operate on vessels of the extremities. So there are quite a few of them available in city of Mumbai.
Right. Thank you. We have one last question,
Yes.
which is from Yasmin Todiwala. It says, I'm 72 and my last two fingers of my left hand do not curl in. What could that be due to, and can I do something about it?
So I assume is the little finger and ring finger which is not curling in. The commonest reason for finger curling in is the same reason that it does not allow it to open completely, which is the tendons getting stuck in this area. So something which causes trigger finger can also cause the finger not to bend completely. Sometimes this inability to bend completely could be because of arthritis of these joints, what we call it the Bouchard's nodes. So we need to find out whether it is a soft tissue problem or a bony problem. Again, a simple clinical examination will work. Until that time that you are able to visit a doctor to get a diagnosis, a simple hot water fomentation couple of times in a day and immediate exercises after hot water fomentation, that of trying to stretch the digits, either active or with the help of the other hand, what is called as active assisted, or completely passive, that there is no effort from this hand, but you just take the other hand and try to move it. This is passive. When you are trying to bend and help, active assisted, and on your own active. These are the three forms of exercises which might help you ease a stiff joint: active, active assisted, and passive.
Great. Thank you, doctor. There are a few questions that we've received which are seeking advice on exercises and diet. Is there some general comment that you could make about exercise and diet? And there's somebody who's also asked that, can I look at doing yoga, because some yoga poses rely a lot on hand strength.
Correct.
And when the hands are feeling weak. So just your general comments about exercise and about diet.
Sure. So anything that you are not accustomed to, you should not try to venture when you already have painful joints. Something which you are absolutely accustomed to, as somebody who's been doing yoga for 25, 30 years, if the person is regularly putting load on the hand, remember, no matter how good your intention, if you are loading a joint repeatedly, it will suffer from a repetitive stress damage. We have to accept that damage as the cost of, as a cost of good health that yoga will bring you. So continue doing it if there is no pain while doing it. There will be certain subtle damage which we have to accept. Every step that we take during our day-to-day walk wears our knee joint. That does not mean that we should stop walking in order to protect our knee joint. So please, by all means, continue doing yoga if you are able to do it without much pain. As far as exercises and diet for the elderly is concerned, my simple advice is, whatever traditional Indian diets that we have been using, you have been eating for all your life, and we all have been eating for generation, for thousands of years, is good enough. You really don't need to look any further. Just ensure that you have good variety in your plate. One. In terms of exercise, I would say your exercise should be directed towards prevention of osteoporosis, and this should be gentle muscular exercises. A simple walk will not give you protection from osteoporosis. A walk is an exercise for your heart, whereas you need to do certain loading exercises for your legs as well as hand. So simple, even just a liter of bottle hand used as a dumbbell to do certain muscle exercise will ensure that there is no osteoporosis of the bones of the upper limb. Simple grip strengthening exercises will ensure that the bones are loaded. If the bones are loaded, they will lose less calcium, they will lose less bone structure, bone matrix, and there will be less osteoporosis.
Thank you very much, doctor, for your time today and for answering all the questions that have come in. I know it's a very specialized area, and we are really delighted that you came in and responded to the various questions that people have had. We've not been able to answer all the questions, but especially concerning the legs and some of the things that may have been repeated. So, but it was really excellent that you to respond to perhaps over 25 questions that have been asked over here. So thank you very much once again. We'll be back as always with another session next Saturday of Health Live at Seniors Today. Those of you who are aware, who have been here regularly, you are aware that we have Dr. Monica Das, who is doing the, who's conducting the, who has been conducting the counseling forum with us. She has she has a WhatsApp group that we have formed where she advises people on the stresses that are being perhaps caused because of the lockdown, because of the COVID situation. So if you want to join the that WhatsApp group, I have posted that link on the chat over here, and you can join that. There are around 30 odd people who are taking advantage of that, who are listening into her advice on weekdays that she offers. And I would take this opportunity once again to thank Dr. Ahire for being here and responding to all our questions. Thank you once again.
Pleasure. It was pleasure connecting with the seniors. Thank you.